This is called a median nerve glide, okay? So it looks funny, but just trust me on this. We're gonna start in a waiter position. We're gonna extend our elbow, wrist, and fingers, and we're gonna point straight down, just like that, okay? Try to get your fingers going down to the ground as much as you can. Yeah, so just right here, I'll show like this. Boom. And we want our fingers to point down. Does anybody feel shaking or tightness or anything while they're doing that? Okay, you do? Where do you feel the tightness at? Like in the shoulder? Okay, anybody else feel that? Yeah, you guys do too? Okay. All right, now compare it to your other side. So we're gonna extend our elbow, wrist, and fingers down, just like that. See if it feels any different. Different? Okay. Anybody getting anything going tingly? Nothing tingling, okay.
My wrist is kind of tingly.
Okay.
I don't feel my fingers anymore.
Amy. Right. Julie, let's have you come up here.
Like they kind of fell asleep.
Okay, what did you feel it more on one side than the other?
These two fingers felt like they fell asleep for real on this side.
Okay, so what we're gonna do is we're gonna use Julie as an example here. So what I want you to do is I want you to extend your elbow, wrist, and fingers. I want you to hold that position. So just holding down like that. Okay, where do you feel it right now? Through there, okay. I want you to bring your right ear to your right shoulder, so side bend. What do you feel now?
Same, it like burns up through, from my wrist up through my shoulder.
Okay, good, take a break. That, my friends, is called neural tension, okay? So, when we're doing this and we add our neck away from it, it puts that median nerve on stretch. Who here has heard of carpal tunnel? Everybody's heard of carpal tunnel, right? In surgeries for carpal tunnel, they go into the wrist and they cut the sheath and they open that up. 90% of the time, it's not even getting entrapped there. We know for Julie that there's something either going on in her neck or something right through here that's like pissing off the nerve a little bit, okay? So what I want you guys to do is I want you guys to do the same test now, but as you're holding it, side bend your neck away. If you get like a zinger or something, like just a heads up, you might get something like that, okay? So just extending that. Anybody here get any zingers? Anything that like increased when you brought your neck? Right, let's have you come on up. Did you get on both sides or one side? Right side, okay. So let's have you, and what?
In the wrist.
In the wrist, okay. So do it without bringing your neck. So just like this, okay? What are you feeling right now?
No.
Okay, now bring your left ear to your left shoulder. So you'll hold that position, there you go.
Now I feel it.
Okay, so we feel that. Anybody else getting that when they bring their neck? Just tightness? Okay, so some people will feel it in the finger. Some people will feel that fall asleep. Some people get it in the forearm, the wrist, up here. Let me show you guys why this is actually relevant to CrossFit, okay? Let me know what motion or movement this is what you guys do every day. That's a snatch, okay? So if we're getting tightness just doing this, guess what we're doing when we're doing 50, 60 reps when we're doing a snatch? We're irritating the heck out of that nerve if we don't have the mobility for it, okay? So if you guys had that, just jot that down. We're gonna go over something to help it. Secretly, the test is the exercise. So if you were getting something like that, we're gonna show you how to glide that.